Like to call the House Health Committee to order. Will the clerk please take the roll?
Representatives Bain, Boyd, Capley, Carringer, Clemens, Faison, Farmer, Gillespie, Hakeem, Hawk, Haynes, Hemmer, Hicks of Hawkins, Hicks of Washington, Hill, Jernigan, Kumar, Martin, Mitchell, Rudder, Sherrill, Travis, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry. Chairman, you have a quorum.
All right, thank you. And are there any personal orders? Chairman Vaughn, you recognize.
Thank you, Mr. Chairman. I'd like to welcome some guests I've got in the audience today, all the way from the District of Champions. First off, my wife, Jonna, as well as Shelby County Election Commissioner Frank Ulehorn and his much smarter, prettier, and better half, Miss Grace. So they're here watching us today. Thank you, Mr. Chairman.
All right, thank you. And as a reminder for those that are on Health Subcommittee, following the completion of our calendar, we will reconvene and take up the rest of the subcommittee calendar this afternoon. So with that, we are going to get into our calendar. We have, I believe, 13 items today. House Bill 1664, where is, or 2664, where is he here? Okay, let's roll that one spot. Okay, without objection, let's roll him 3 spots. Okay, brings us to House Bill 1146, Representative Vital. Oops. Okay, you have a motion and a second. I believe you wanted to say a few words here.
Thank you, Mr. Chairman, committee. As many of you know, my mother passed away over the weekend, and I was occupied all weekend with her service and burial on Sunday, so I did not have an opportunity to visit with many of you about this bill. This is very important legislation, and I would like to roll it for a week if possible. Thank you.
All right. We are, heart goes out to you and your family in this time, and so you take care of your business. So without objection, this bill will be rolled 1 week.
Thank you, committee. Thank you, Mr. Chairman.
All right, that brings us to item number 3, House Bill 2261. Representative Wright, you are recognized.
Thank you, Mr. Chairman and committee. I affectionately refer to this House Bill 2261 as the Golden Girls Bill in subcommittee. This bill defines a home for the aged that houses 3 or fewer non-related persons that would be subject to licensure and regulations by the department. These housings could be happening right now. We only find out about them through through neglect and report. This sets up a program to go check. It gives people a relatively permanent place to reside, may help with medication, and could be compared to small headcount daycare or the inspection of a beautician located in the home. My most recent head count on this bill is that 8 of the 27 people signed on to the bill are on this committee, and I thank you and I seek your continued support. And with that, I'll stand for questions.
All right, do we have any questions for the sponsor of the bill? All right, seeing none, we are going to vote on House Bill 2261. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chairman and committee.
All right, thank you. And are you carrying item number 4?
Yes, Mr. Chairman.
Okay. Senate Joint Resolution 918. You have a motion and a second. You are recognized.
Thank you, Mr. Chairman and committee. This is a resolution addressed to the Honorable Bill Lee, Governor of the State of Tennessee, the Commissioner of Veterans Affairs, and the Commissioner of Mental Health and Substance Abuse Services. As we search for the most effective strategy to prevent veteran suicides. We find that peer support empowers people living with behavioral and health challenges to receive help, their best help, from those that have been there and done that. The Certified Peer Recovery Specialist Program provides state certification for individuals who provide direct peer-to-peer support services to others who have mental health and substance abuse problems. A similar peer support program for Tennessee veterans and active service members would be an invaluable tool in preventing suicide among this population. My comment the other day was that I'm proud that I have served in the U.S. Army. I had an experience, didn't say an enjoyable experience, but I had an experience that I would not back up on. There are, though, several that have served in the military, the armed forces, previously or in current active duty, that have not had the best of experiences, and a program like this to help prevent suicide would be most beneficial to the citizens of the state of Tennessee, and I request your support on this Senate Joint Resolution. Thank you, Mr. Chairman of the committee.
All right. Thank you. Representative Gillespie, you are recognized.
Thank you, Mr. Chairman, and sponsor, thank you. I just want to say I had a friend in high school, Karen Thompson was his name. He served honorably in Afghanistan and as a medic, and tried to get help back here. And unfortunately, that was not, there was not as abundant help then as there is now. And I think this will make it even better. But he's unfortunately no longer with us. And thank you.
Thank you, Mr. Chairman, and thank you for saying the name of that person that has served.
All right. Thank you. Any further questions for the sponsor of the bill? Okay. Question has been called. Without objection, we're voting on Senate Joint Resolution 918. All those in favor say aye. Opposed? Ayes have it. Resolution goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
All right, thank you. That brings us back to item number 1, House Bill 2664. Without objection, we're going to roll that to the heel. That brings us to item number 5, House Bill 2897. Chairman Kumar, you are recognized. You have a motion and a second, and I believe there is an amendment that rewrites the bill. Is that correct?
Yes, Mr. Chairman, I have 15593.
Okay. You have a motion and a second. If there's no objection, let's go ahead and get the bill in proper order. All those in favor of Amendment 015593 say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. Members, there are many players, including pharma, insurance companies, PBMs, pharmacies, and ultimately the consumer in purchase of a drug prescription. As simple as it should be, it is not. The insurers at times own the pharmaceutical companies or pharmacies and will pay higher than usual prices because they're paying basically to their own subsidiary. The result is that the copay goes up for the patient, and there are situations where patients' copay while using their insurance card is higher than the drug availability on regular market. The only person who knows and can be of help is our local pharmacist from whom we purchase the medication. This bill asks the pharmacist to make a reasonable effort to help the patient by discovering alternative methods by which they can purchase medication at a better price. Now, let's be aware that when a patient purchases a drug using a coupon or otherwise, at a cheaper price, that money is not through insurance companies, so it will not go towards the patient's deductible unless we call the insurance company and say that I use this coupon or this alternative method, in which case we did pass legislation that it will count towards the deductible. With that explanation, I'll be pleased to answer any questions.
We have any questions for the sponsor of the bill? All right. That question has been called. All those in favor of House Bill 2897 as amended, say aye. Aye. Opposed? Ayes have it. Bill goes on to Counter and Rules. All
Thank you, Mr. Chairman and committee.
right, that brings us to item number 6, House Bill 2308. Chairman Vaughn, you are recognized.
Thank you, Mr. Chairman. If you don't mind, I'll hang out here.
Go right ahead.
All right. Current law prohibits hospital outpatient clinics from being able to use nurse practitioners to enroll patients into its own clinics that prescribe buprenorphine for substance abuse. And in practice, this means that patients are then held in inpatient rooms of hospitals for longer than they need to be. Because of the way the current law is worded, hospitals and their attached outpatient clinics are not able to obtain licensure as an OBOT clinic. The current licensure mechanism authorizing nurse practitioners to operate in substance abuse clinics, those OBOTs, contains limiting factors that hinder teaching hospitals from being able to participate. This bill would create new requirements for hospitals wanting to use NPs as part of their opioid abuse clinics that see patients in both their inpatient room and in their attached outpatient clinics. This was brought to us by Vanderbilt University Medical Center, and they were seeing patients staying in inpatient rooms longer than they needed to when they could have been treating them for the same issue in their outpatient clinics. And sounded to me like a good way to free up hospital beds for those in need. And so with that, sir, I'll stand for any questions.
All right, I think we got some housekeeping to do here. I think you have an amendment 015746. Is that correct?
Yes, sir. I got all worked up ahead of myself. So 15746.
Okay. All right. Without objection, let's vote on that. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. Do we have any questions for the sponsor of the bill? All right. Seeing none, we are voting on House Bill 2308. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to Calendar and Rules. That brings us
Thank
to.
you, Mr. Chairman.
Thank you. You're welcome. Brings us to item number 7, House Bill 2086. Chairlady Hilton Haynes, you are recognized.
Thank you, Mr. Chairman.
Need a,
I do have an amendment.
okay, you have a motion, a second. All right. And we have an amendment drafting code 015039. Is that correct?
That's correct.
Okay, you have a motion and a second on that, and that rewrites the bill. So if there's no objections, let's go ahead and get the bill in proper form. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. House Bill 2086 as amended intends to codify that for-profit entities may not access 340B program in-kind contributions from the state of Tennessee, as these donations are meant for our safety net providers.
Any questions for the sponsor of the bill? All right. Seeing none, we are going to vote on House Bill 2086 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Calendar and Rules.
Thank you, Mr. Chairman and committee.
That brings us to item number 8, House Bill 2358. Chairlady Carringer, you are recognized. You have a motion, a second.
Thank you, Chairman. Since I'm had the honor of sitting down there on the front row.
And we have an
today-
amendment, I believe, as well.
Yes, I do.
Okay. Okay, 015314.
That's correct.
Okay, there's no objection. Let's go ahead and get the bill in proper form. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Chairman and committee. This is really, I have to say, an awesome bill. So House Bill 2358 was brought to me by Tennessee Oncology, which is the largest oncology provider in Tennessee, and was brought about to help reduce the amount of drug waste and providers currently face in providing care to oncology and hematology patients, thus curbing the cost increase of providing care. Due to some changes in guidance at the federal level, physician-owned pharmacies such as the one that services Tennessee Oncology's 33 clinics in East and Middle Tennessee can no longer ship medication to patients' homes. With many oncology patients living in rural areas, sometimes an hour or more away from their nearest clinic, the physicians often try to predict what drug the patient will need and have it ready for them when they arrive at the clinic. The problem arises when the cancer has changed or the patient's lab results make it necessary to change medications or doses. The correct prescription is ordered, but the one that was waiting on the patient is considered waste under Tennessee law, as it has technically left the pharmacy and cannot be restocked and is considered waste. That has resulted in over 1.6 million in wasted medications in the last few years, some of which are hard to find medications and can run as $10,000 a month. And so with that, I want to thank the Tennessee Oncology, and I also want to thank our Board of Pharmacy that has addressed this issue and has helped craft this amendment and this bill for us. And so with that, I will ask for your support and here to answer any questions.
All right. Any questions for the sponsor of the bill? All right. Seeing none. Great bill. Find me a sign-on sheet before you get a little bit further here. So with no objection, we'll be voting on House Bill 2358 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways, and Means.
Thank you, Chairman and Committee.
That brings us to item number 9, House Bill 2366. Chairlady Carringer, you are recognized.
Thank you, Chairman.
Need a motion.
So House Bill 2366 is also.
Yeah, you have a motion to second. Okay.
So House Bill 2366 is also a good bill for the state of Tennessee. Currently, state law allows physicians who graduated from a U.S. medical school to obtain a Tennessee medical license after their first year of residency. And with that, they can do what is called moonlighting. But it requires international medical grads. And these international medical grads have taken the same step 1, step 2, step 3, and all of the medical boards as the U.S. medical students have taken. And they have completed all these steps, or they would not be in residency here in the state of Tennessee. So what this would allow is, after the international medical graduate has served and done their first year residency, be able to also moonlight. Instead, right now, they have to wait till after they finish their 3 years of training. So with that, I will ask for your support, and I'm here to answer any questions.
All right. Got some housekeeping to do here. I think you have an amendment 016690. Is that correct?
That's correct.
Okay. If there's no objection, we're voting on amendment 016690. All those in favor say aye. Aye. Opposed? Ayes have it. Back on the bill as amended. Any questions for the sponsor of the bill? Seeing none, we're going to vote on House Bill 2366. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Chairman and Committee.
And, well, we have the Carringer portion of the calendar here.
I've been working, guys.
So, all right. We are on item number 10, House Bill 2861. Lady Carringer, you are recognized. I need a motion. You have a motion, a second.
Well, and I appreciate that, and I will save you all another week on this bill because there were some typos with an amendment. So we're going to bring that back hopefully next week. House Bill 2861, I want to roll for a week.
Okay, without objection, House Bill 2861 will be rolled 1 week. That brings us to item number 11, House Bill 0628. Chairman Leatherwood, you are recognized.
Thank you, Mr. Chairman, and
You have a motion, a second.
I have an amendment on the bill.
Okay, amendment drafting code, is it 015748?
That's correct.
Okay, gotta get a motion? You have a motion, a second. Okay, if there's no objection, let's go ahead and get the amendment on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Mr. Chairman and committee. This bill will help to encourage providers to seek treatment for career fatigue without any stigma, which could actually cost them their job or keep them from getting a job. It establishes the Tennessee Wellness Act and enacts these protections for physicians and osteopaths seeking to help address career fatigue and workplace burnout. With that, I appreciate y'all's support and take any questions.
Did you have somebody that was going to testify, or
If need be.
if there's
Can
any?
everybody give me a show of hands if you're for
Yeah.
the bill?
No.
There you
Okay.
go.
All right.
Yes, we,
Would you like them to testify or no? Question has been
Question on the
called.
bill. There
Question
you
has
go.
been called. All right, if there is no objection, we're going to vote on House Bill 628 as amended. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to government operations.
Thank you.
Thank you. That brings us to item number 12, House Bill 1846. You have a motion and a second.
Thank you, Mr. Chairman. I've got a little housekeeping here. I've got one amendment with the bill, 14521, and then I have a late file amendment.
Okay, 14521. Okay, we have a motion and a second on that, and let's, if there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We have a late filed amendment that changes the date. Is that correct?
Yes, Mr. Chairman, and that's 17066, and all that does is just changes the enactment date.
Okay. So you have if there's no objection, I have a motion, a second on that. Let's go ahead and put that on the bill. All those in favor of amendment 017066, say aye. Opposed? Ayes have it. We're back on the bill as amended.
Thank you, Mr. Chairman and committee. I appreciate your consideration of this bill. This just simply would require the Department of Health to submit an annual report to the governor detailing the total number of firearm injuries and deaths, as well as some demographic information caused by firearms in this state per 1,000 people in each year. And it requires the Attorney General and reporter to assist in that to the extent necessary upon request. And that's the whole bill. I'd ask for your vote.
Any questions for the sponsor of the bill? All right, question has been called. All those in favor of House Bill 1846 say aye. Opposed? Ayes have it. Bill goes on to calendar and rules, and will the legal roll this into one amendment moving forward? All right, thank you.
Thank you.
That brings us to item number 13, House Joint Resolution 820.
Thank you, Mr.
Representative
Chairman.
Travis, you're recognized. You have a
Thank you,
motion, a
sir.
second.
This resolution calls for elected U.S. representatives and senators representing the state of Tennessee to take all steps necessary and reasonable to end taxpayer funding of the World Health Organization.
Do we have any questions for the sponsor of the resolution? Representative Bain, you're recognized. You're recognized. Oh, that thing was broken. Yeah. Phone a friend.
Thank you, Mr. Chairman. Representative Travis, I'm just curious about the genesis of this bill and if, I guess, the impact in your district.
Yes, Representative. It's been across with the failure of the COVID pandemic that came across in 2020, and the Congo, where they had over 100 women in Congo reported who had been raped by the WHO staffers and affiliates.
Okay. So some of you may not know, but I worked at the UN for a year in 2016 and across from the WHO. And I arrived at the apex of the refugee crisis, and I worked in collaboration with a lot of these national organizations that, even though maybe we can't quantify its impact locally, that they are critical for preserving our global infrastructure in terms of fighting diseases, et cetera. Any thoughts?
You're recognized.
Thank you, Mr. Chairman. Yes, but they have really been slacked in the last couple of years of what they do and the good they do, because, the Ebola that come out and the COVID, they just didn't respond, and we pay them up to $700 million of taxpayers' money a year. And I think we should be getting more than what we're getting from the WHO.
You're recognized.
Thank you, Mr. Chairman. I'll just say that I want to recognize that this may have come from your district, from your constituents, but I think this is a waste of our time and taxpayer dollars, because this is only something that the U.S. Congress and the Biden administration would deal with in terms of WHO pandemic treaty.
You're recognized.
Thank you, sir, and thank you, Representative. But this, like I said, this is HJR, and so that's what this is, and this is what it does.
Chairman Williams, you're recognized. Question has been called. If there's no objection, we are voting on House Joint Resolution 820. All those in favor say aye. Aye. Opposed? Ayes have it. Resolution goes on to calendar and rules. If you wish to be recorded as a no, please tell the clerk. All right, that brings us back to item number 1, House Bill 2664. And I have gotten word that the sponsor wishes to roll that for 1 week. So without objection, it will be rolled 1 week. That brings us to the end of our work here. As a reminder, the subcommittee will be meeting here immediately following. So we are adjourned.